Hey guys, welcome to Podiatry Practice Mastery. Don here. Recently, I went to we had a Region 1 APMA meeting here in Massachusetts, and I just want to talk about the 3 practice management takeaways from this conference. It was a good conference. Mostly it was surgical and medical, and there's some good points, but my mind, as if you've been listening to me for a long time, tends to focus more towards the practice management takeaways. So the first takeaway was the importance of doing role playing. There was a neat session that Cindy Pezza did, and I've interviewed her before, and Cindy has her own kind of things where she helps medical assistants. She does great work, helps a lot of doctors opening up their offices. But what I really appreciate about Cindy is that she was able to do a talk that had both doctors and medical assistants in the same room, and she incorporated role playing. Now, I don't know how many of you do role playing, but role playing is really the best way to get better at doing something. For example, answering irate questions from patients, or even we were kind of doing an example of how you do initial intake on a patient. But I believe that doing role playing, especially with new staff, is a really good way of helping to train them, especially with difficult situations that they're going into. So where in your practice can you incorporate just some simple role playing? I know we have a new doctor, and not too new anymore, but doing that role playing, especially with certain conditions, makes it a lot easier. Kind of going through, we already know how to ask the questions, but then how do you explain things? Like certain things that are a little bit more challenging, a little bit more complex, like plantar fasciitis and all the different treatment options and things like that. So the first thing was the role playing takeaway. The other takeaway was how everyone always stresses about having protocols, and we all have our protocols in our mind, and we're just reminded again the importance of having them written down. And so what I've decided to do, and where I wanted your help, everyone that's listening, is I have put together, and I think a lot of you have downloaded the patient presentations. If you haven't, you just join Podiatry Practice Mastery, and then the first thing there are these presentations. Eventually, I'm going to turn these into a product to sell, but for now they're free, so I would go download them. And I've been talking to people about it. I was talking to someone this weekend, and I don't use all of them for every single diagnosis. It's mostly the more complex things. Okay, so the more complex things, Achilles tendonitis, plantar fasciitis, those are the 2 I use 80% of the time. And the other ones I might use if I just want to show something quick. But I want your help, and so I'm going to put a little link under this video of the one. I'm going to start with the one on plantar fasciitis. So I've thought about how can we get more collaboration. So I am going to put a Google Doc underneath this, and we are I'm recording this actually in the month of, starting in November. So for the month of November, I just want to start with plantar fasciitis. So in this Google Doc, I'm going to put a link to my presentation, and I want to just have people write down different things, like what works for you, what's working really well for you, what you would tweak, what you would improve, so we can have some collaboration. I was thinking about a Google Doc. That's the easiest way, so you can just go in there and type in it. If you have a better option, let me know. If you think WhatsApp would be better, or a Facebook group. But I try to stay away from Facebook just because I don't go on there, and I think it's a time suck. And so I'm going to try it with this Google Doc. So it's a Google Doc anyone can log into. You can get my presentation, and more importantly, what was talked about at that at the conference is the importance of protocols. And I have to confess, I kind of have them in my mind. I have my checklist, but I've never kind of, and the reason is it seemed a little not complex, but there's a couple of variables, and like everyone else, you're probably saying, I don't want to treat the same people the same way, and so I have the same complaints of everyone else, but I'm just going to do it. So I want to have it done so I can help other people. So basically, after my checklist is where I'm going to put in the protocol, right? And so the work up in my mind is basically the stuff they can do before they visit. So it would be phase 1. and then maybe phase 2, phase 3, and then surgery. That's kind of that's working up in my head of how to arrange things. But the thing is, there's so many different categories, and it just seems like a hodgepodge and mesh of words. So I'm trying to figure out how to lay it on the slide that would be the best way. So there'll be a link underneath to check it out. Let me know what you guys think, if you have a better way of organizing it. I thought about doing it based in like reducing soft tissue tightness, which would be like the stretching and the foam rolling and things like that, reducing pain, and then like stabilizing the foot, like with orthotics or AFO or things like that. So I would like your feedback. So that was the second takeaway. And the third takeaway is I was in this room, and maybe this is just Massachusetts, but it's mostly old men. and I know I feel bad saying that, but as I'm trying to propagate this podiatry practice mastery, I've realized like old men don't listen to podcasts. And that even goes to show, when I was looking at the demographics here of who's listening to this, it's about 80% in the U.S., 20% abroad. There are listeners, and I want to thank you, the listeners from Canada, from Australia, from Europe. There are different podiatrists listening, and it's probably in the demographics, it's people younger than me, people that are interested in this method. So I'm thinking if I want to reach more podiatrists, I'm going to probably have to switch the means or do it in multiple methods. That's what kind of came up in my mind. I was thinking, wow, what do old people look at? Or older people, like how can you provide benefit? And so I'm doing all this like high-tech techies things with like Google Slides, and I'm thinking, they don't even, they might not have computers in their office, or they don't use computers, or they're not, so I have to figure out a way to simplify it. And I think the way of simplifying it, getting the message out, is probably going to be maybe with YouTube videos, and then maybe just emails. Because I don't know if these people know how to use membership sites. And so maybe just to email something about information, a written email versus like video, because they might not watch videos. Or maybe you're in your office where you can't watch the video. So that's my thought about that. And then like, how can I provide more content or more value for other people that aren't like techie? Because I'm thinking the majority of people in our profession just aren't techie. And it's probably going to be like just a simple website. That's what I'm thinking. Just a website where you got the patient presentations on there. You can either have the PowerPoint, or you can do the video. And you don't have to have anything else. You can do it on you can do it on an iPad. Just go to that website and do it. That's what my thoughts are. I would like your feedback. Please post a reply here underneath this video, or send me an email at don@Podiatry Practice Mastery. And once again, please participate in this thing about plantar fasciitis. We all treat it. I'm going to put down my initial thoughts, and then you guys can edit it if you want. And just, we'll kind of work it out. I don't know how you're going to be able to determine who's adding what or what's going in there, but we'll figure it out. Okay, I'm going to put an open doc. I might switch it to like a form. A form might be an easier way for me to control. But it's kind of like Wikipedia, right? Like Wikipedia, anyone can delete or add anything to Wikipedia. So if you delete everything, well, I guess you delete it. If you don't know what you're doing, probably don't log in, because you might delete everything for the other people. Okay, once again, thanks guys. Have a good day.